Welcome back to the show, everybody. May, as you may know, is Mental Health Awareness Month, and we have two lovely ladies who are very concerned and very involved in that space with us right now. We have Nadine Cepeda and Marilyn Minral. Hafa ladies.
Miral.
Okay, thank you.
Sorry.
Yeah, thank you very much, and thank you for the correction. Okay, so Nadine, you are a social worker supervisor for adult counseling, and Marilyn, you are a acting supervisor for community support services. What are your capacities as far as providing, services both to those afflicted by mental health, I guess, as well as their families reaching out?
Well, pretty much we welcome anybody who needs services from all wide spectrum of mental health issues or concerns. So people who are high functioning, perhaps need some counseling, perhaps with stressors in their current life, to people who have a mental illness and been diagnosed with it formally. So we have counseling services, we have medication, and that comes or overseen by psychiatrists. We have psychological services, we have social worker, which is case management, we have nursing, we have Healing Hearts, which is our Healing Hearts Crisis Right Center. So we have a variety, and we definitely take on, we have a huge capacity of helping people in their community.
Okay, well, Marilyn, from a social worker's and a caseworker's standpoint, does Guam have more, like Nadine was saying, people who may have been born with a mental affliction, or do they develop it as a result of some very, very traumatic experience?
Well, in my experience, sir, I think it's a little bit of both. Certainly with mental illnesses, there is a genetic disposition to it, but I also think that the environment plays an important part in developing it, perhaps. Perhaps if they're experienced some traumatic experience in their life, that can certainly trigger the onset of it.
Mm-hmm. Now, what types of activities are ongoing? Because I'm sure you ladies and your colleagues, and we've interviewed a few of them already here on the show. Mm-hmm. You guys are going to be very busy for May, doing outreach and making people aware of exactly what happens here on the island, and then what mm-hmm. services are available to tend to that.
That's true. Actually, we just had a proclamation signing for the Children's Mental Health Month.
Love those.
And then this past weekend we had Mass. To kind of open up the week, and that was held at the Cathedral this past Sunday, as well as St. Jude's in Sinohanya. And then we have activities this coming week. We also do stuff with Department of Public Health and Social Service, Project Carinu. Mm-hmm. They have an open house on the 6th, and then we have one at Ifa Magunta, and that's our Children Adolescent Services Division, and that's on the 8th, and that's from 1 to 5. So we welcome everybody to come down, see what services we do have to offer, and then anyone's more than welcome to come to the main facility, and that's at the department, and we're into money. And then we have substance abuse as well as prevention I didn't mention, and then we have a wave this coming Friday at 4 o'clock in the ITC intersection.
So based on what both of you ladies are saying, there is a great deal of mental illness that's behaviorally influenced out here. Like we were saying again, people may go through traumatic or very mm-hmm. life-altering experiences, in addition mm-hmm. to people who are unfortunately genetically they mm-hmm. inherit that kind of thing. So how do you treat both of those cases where someone may have something that may be part of their psyche, be part of their DNA, mm-hmm. or someone who like they may have lost a loved one or gone through mm-hmm. a very nasty divorce, or mm-hmm. like something like that really changes who they are?
I think that we do provide an array of services at the Guam Behavioral Health and Wellness Center, and I think depending what their needs may be, we have them see the doctor or psychiatrist, who can then assess if maybe for someone who may be suffering from a major depression, then the doctor may assess them if there's a need for them to be maybe put on medications. We also provide, like Nadine said earlier, individual counseling to help them cope with day-to-day stressors. And then and we provide a lot of support for those individuals who may be suffering from serious mental illnesses. And that's the support that we really try to help them improve their quality of life through the array of services that we have.
And if I may add, the intake actually is the gateway to any services at mental health. It's a clinical assessment interview, and that determines gathering the history, the presenting issues. Then it gives us a better direction for our disposition and what our recommendations are for the services that we do offer at the center.
Well, I know so many people here on the island would probably say, they'd like to help somebody that they love or someone in need, but cost is always like a huge factor, and they say, I don't know if I want to go to like a really expensive clinic or go see a specialist and everything like that, because they know that's big money. How do you guys address people, for whom finances are always a challenge.
Well, we don't turn anyone away. And so I need to say that for the record. We welcome everybody. However, if you do have insurance, then we bill the insurance. If someone comes in and don't have insurance, we still see them. So regardless, we provide the services they do need.
All right. Well, ladies, thank you so much.
Thank you.
We appreciate what
Thank
you do
you.
for the
Thank
island.
you.
All right. We are back right after this. Please stay with us. You're watching